So today we're going to be talking about the American Spinal Injury Association. It's also called an ASIA assessment. And in this assessment, medical practitioners use this to determine the degree of a spinal cord injury in a client. So today we're going to be doing a case study. So our scenario is you are caring for Jane Doe, a 55-year-old woman who recently experienced a spinal cord injury as a result of a motor vehicle accident. The physician is performing an ASIA assessment to determine the degree of injury. In their examination, they report the following. 1. Normal light touch and pinprick sensation down to T4 on the right side of the body. Normal light touch down to T4 and normal pinprick sensation down to T5 on the left side of the body. And motor functions as follows. This person does have voluntary anal contraction, which means when a finger is inserted up the rectum, the client can squeeze the finger, and this client also has deep anal pressure, which means that when a finger is inserted up the rectum, the client can feel the finger. And so the questions for this assessment that we want to figure out are, what is the neurological level of injury? Is this a complete or incomplete injury? What ASIA impairment scale letter are they? The ASIA impairment scale goes all the way from A to E, where A is the most severe and E is normal. And finally, should this be classified as an injury that is trauma or non-trauma? So to begin, we can actually answer this last question here, is it trauma or non-trauma? Because in our question, it was told that this client got their spinal cord injury as a result of a motor vehicle accident. So that's a traumatic injury where something external has caused their injury. An example of a non-trauma injury could be a tumor on the spine, or perhaps the injury could be a result of removing that tumor from the spine. So first of all, we're going to look at, this is what the assessment looks like. It's already been filled out, but we're going to walk through in terms of how this got filled out. For nurses do not conduct these assessments. It would be a physician that conducts the assessment. However, it's very, very helpful to understand how to interpret this assessment so that you have an idea of what to expect with your client before you go and see them. This assessment will be in the client's chart that you can look at before you visit them. So first of all, what's nice is on the back of this assessment, it kind of gives us a walkthrough of everything that we need to know. So we have steps where we first determine sensory levels for right and left side, and it also tells us how we grade those sensory levels, where 0 is absent, so the person doesn't have any sensory sensation at all. 1 is altered or decreased or hypersensitive. 2 is normal, and NT is not testable. So for example, if you're testing sensation near the right hand, but the person has an amputated right arm, then you'd put not testable. And then next would be determine motor levels for right and left side. So we have muscle function grading, where 0 is total paralysis all the way to 5, which is normal. Again, not testable. If you were supposed to test finger abduction, but that person is missing that hand, then you would write not testable. So, and then finally we can determine the degree of injury and whether it's an incomplete or complete injury. So let's first look at our case study, and we see that this person has normal light touch and pinprick sensation down to T4 on the right side of the body. So when the physician is testing this, they'll use maybe a pin with a dull end and a sharp end. So light touch would be with using the dull end, whereas pinprick would be using the sharp end. And on our assessment, they give you a handy diagram that even shows you what part of the body corresponds with what part of the spinal cord for sensory. So it helps you in terms of where you would put that dull or sharp touch. So as we can see in our question, this person has normal light touch and pinprick sensation down to T4 on the right side of the body. This is the right side, this is the left side. So we can put normal, which is a 2, all the way down to T4. And we can assume based on how the question is written that everything else would be a 0 because it didn't provide us with any other additional information. So that's how we got 2s for these two columns for light touch and pinprick. And then we go back to our question and it says normal light touch down to T4 on the left side of the body. So normal light touch, which is normal's a 2, all the way down to T4. And normal pinprick sensation down to T5. So we go all the way down to T5 for a pinprick for the left side of the body. And then we can assume based on how the question is written that everywhere else down is a 0, so no sensation. Next we have some motor function. So the physician has already conducted this examination where they've observed motor functions. Usually when it's written, it can be written as like a right dash left, so for the right side and for the left side. We can see here on our chart that 0 is total paralysis, all the way down to 5 is normal. So 4, active movement, full range of motion against gravity and moderate resistance in a muscle-specific position. 3 is active movement, full range of motion against gravity. 2, active movement, full range of motion with gravity eliminated. 1 is palpable or visible contraction. So we were given these results. Elbow flexors, 5 out of 5. Wrist extensors, 4 on the right side, 5 on the left side. Elbow extensors, 4 on the right side, 5 on the left side. Finger flexors, 1 on the right side, 3 on the left side, and 1 for finger abductors, which is your little finger, on the right side, and 3 on the left side. So now that we have that information, we can also go in and ask ourselves about that voluntary anal contraction. So can the person squeeze a finger that's inserted in their rectum, and can they feel a finger that's inserted in their rectum for deep anal pressure? In this case, the patient could, so we'd say yes and yes. So now we can start going to some of our questions. So we can see down here that we now get to fill out the neurological levels of injury. And how this is done is we'll start with sensory. We look all the way down to where we have normal sensation. The last point where we have normal sensation on the spinal cord. So for the right, that would be T4. And for the left, that would also be T4 because as you can see here at T5, we've got normal pinprick, but we don't have any sensation for light touch. So in terms of sensory, T4 for each side. And then motor is a little bit different. So we'll look at the right side. So what you do is you look at, you find the point at which the person has normal motor function. So that would be C5. But then you do have to look down to the next one below. And if it's either a 3 or a 4, then that is going to be the motor level of injury. So in this case, we look, okay, C5 is a 5, and then look down one more, C6 is a 4. So that's going to be our point for the right side. Looking at the left side, our 5 is at C7. And then if we look one more, C8 is a 3. So C8 on the left side is going to be our point. So C6 and C8. Neurological level of injuries, we're going to look at the levels that we put down here, and we're going to pick the point that's highest on the spinal cord. In this case, C6 is the highest level on the spinal cord. Is this a complete or incomplete injury? So for a complete injury, this person wouldn't have voluntary anal contraction, and they wouldn't have deep anal pressure, and they wouldn't have sensation at S4 and S5. In this case, the person doesn't have sensation at S4 and S5 because we assume that everywhere else down below is a 0, but they do have voluntary anal contraction and deep anal pressure, which means that some sensation is getting all the way down. So now the part that we have to figure out is, we know it's incomplete. We have to figure out what letter on the ASIA impairment scale this person is. So there's a handy little flowchart on the back of each sheet. So is the injury complete? If yes, ASIA A, we already determined that it isn't complete because they do have voluntary anal contraction and deep anal pressure. So is injury motor complete? So no means voluntary anal contraction or motor function more than 3 levels below the motor level on a given side if the patient has sensory incomplete classification. So we do know that this person has voluntary anal contraction, so they are not motor complete. And then the question that we have to ask ourselves is, do they have at least half, so half or more, of the key muscles below the neurological level of injury graded 3 or better? So if we look, so the neurological level of injury is a C6, and so these are not, we'd assume that these are also a 0 because the question didn't provide them for us. So as we can see here, this would be no, that they do not have more than half graded as below the neurological level of injury as 3 or greater. So since we're answering no, then that means that they are classified as a C. Zone of partial preservation would only be filled out if we had a complete injury, so this isn't applicable. So looking back, what is the neurological level of injury? We determined it was C6. Is this complete or incomplete? We determined it was incomplete. ASIA impairment letter scale was a C. In trauma or non-trauma, this is a trauma because this client sustained their injury as a result of a motor vehicle accident.